honor to be invited to share my research on this platform. And in today's presentation, I will share a preliminary study on understanding the dementia prevention among Chinese adults. This study was conducted because though much progress has been made on identification of dementia risk factors in research, but less is known about people's awareness of this evidence. So such a study is needed to inform future dementia prevention strategies. And I'm very looking forward to the interaction and future collaboration with researchers, practitioners, and policymakers on this platform to strengthen our efforts on dementia prevention. So in today's presentation, I will first discuss the contemporary scientific evidence on the risk factors for dementia. And then I will share the study findings, which show great gap did exist between the understanding of dementia prevention among Chinese general public and research progress of dementia prevention. And at last, I will discuss some insights derived from the study findings, which might work to bridge the gap. So first, what is dementia and what's the impact of dementia? Dementia is a syndrome in which there is a deterioration in cognitive function and what might be expected from usual consequences of biological aging. And dementia has its physical, psychological, social, and economic impacts not only for people living with dementia, but also for their caregivers, family members, and society at large. And dementia is currently the 7th leading cause of death among all diseases, and one of the major causes of disability and dependency among older people globally. And these are the 3 alarming figures from Alzheimer's Disease International. Every 3 seconds, someone in the world develops dementia. In 2019, 55 million people were diagnosed with dementia, and this figure is going to be almost tripled in 2050. And in 2019, the total estimated annual value, annual worldwide cost of dementia is over $1.3 trillion, and this figure is forecast to rise to 2.8 trillion by 2030. So therefore, dementia has reached the forefront of public health agenda. Regarding the dementia treatment, there's currently no treatment available to cure dementia, and anti-dementia medicines and disease-modifying therapies developed to date have limited efficacy. But while there's no curative treatment for dementia, more and more evidence indicate that the proactive management of modified risk factors can delay or slow onset or progression of the disease. Actually, there are 2 kinds of dementia risk factors, non-modifiable and modifiable. The non-modifiable risk factors of dementia include old age, female gender, family history of dementia, and genetics. And for the modifiable risk factors in 2019, the WHO released the guideline on the risk reduction of chronic decline and dementia. This guideline reviewed the existing evidence on the most substantial dementia risk factors, including hypertension, dyslipidemia, diabetes, obesity, depression, hearing loss, alcohol abuse, smoking, social isolation, and physical activity and cognitive activity and healthy diet were identified as preventive factors for dementia. It is estimated that these 12 modifiable risk factors could explain 40% of total cases of dementia globally. So this evidence really highlights opportunity for dementia prevention. Indeed, back in 2017, the WHO released the Global Action Plan on Dementia, which urges all countries to implement campaigns to raise public awareness about dementia. And so one of the major priorities to inform this action is to determine the knowledge gaps about the cognitive health and related risk factors among the general public, so that education program can be most effectively targeted. So therefore, our research team conduct the study to assess understanding of dementia prevention among Chinese adults, and This study aimed to compare the Chinese general public's understanding of dementia prevention and the latest scientific evidence, and to further identify the social demographic factors related to beliefs and level of knowledge regarding the dementia prevention. The study findings were published in December last year. So this preliminary study is a cross-sectional study, a consecutive sample of 358 adults aged over 40 years old who visited community health centers in Hangzhou City, or for general medical service, they are recruited. For participants, if they have diagnosis of dementia or have impairing hearing or vision, which may inhibit them from giving consent on certain questionnaires, they were excluded from this study. So the questionnaire used in this study to assess the understanding of dementia prevention was designed by the research team. This questionnaire has three sections. The first section is about beliefs of dementia prevention. It includes two questions. They are, do you think that dementia is caused by normal aging? And do you think that the risk of dementia can be reduced? And for the second section of this questionnaire is about 12 risk factors for dementia. They are chosen based on the WHO guideline. And the last section is about health education needs regarding dementia prevention. This part includes two items. Ask the participants whether they are well informed about dementia prevention from public education, and ask them to choose which dementia health education delivery format do they prefer. We also collect key social demographic information, include age, gender, education, income, whether they have memory complaint, and whether they are in contact with someone with dementia. These are the social demographic characteristics of the respondents. The results regard the beliefs of dementia prevention. 41.9% of the respondents agree that dementia is caused by normal aging, and less than 1/3 of the respondents agree that the dementia or a dementia risk could be reduced. And among all the dementia risk factors, depression was mostly endorsed by the participants as the risk factor for dementia, followed by social isolation, cognitive inactive, physical inactive, and hearing loss. However, the cardiovascular risk factors include alcohol abuse, dyslipidemia, hypertension, diabetes, obesity, smoking, and unhealthy diet. They were less endorsed by the respondents. So previous studies also found that people are less aware of the role of cardiovascular disease management in the development of dementia. And this may reflect the fact that dementia is predominantly regarded as a mental illness by the public, and there is a lack of health education for the public to connect cardiovascular disease with dementia. This preliminary study finding indicate that overall the knowledge level of the risk factors of dementia among Chinese general public is poor. And when compared the finding to those in the Western countries, we found that proportion of participants who hold the misconception that believe dementia is caused by normal aging is similar to that in the US, but it's much higher than that in European countries like Ireland. And for the proportion of study participants who believe that dementia could be preventable, this proportion is much lower when compared to that in Australia and South Korea. So this misconception may delay seeking professional help and taking health behaviors to reduce the risk of dementia. Regarding the results on the factors associated with dementia prevention beliefs, we found that compared with the middle-aged participants aged over 70, they were more likely to believe that dementia is caused by normal aging, and they are less likely to believe that the risk of dementia could be reduced. And compared with the participants with a lower education level, participants with a higher education level, they were less likely to believe that dementia is caused by normal aging, and they were more likely to believe that dementia can be preventable. And compared to those who have contact with someone with dementia, those who have no contact with anyone with dementia, they were also less likely to believe that dementia can be preventable. So additionally, the knowledge level of dementia risk factors are also significantly associated with some social demographic variables. Um, older people compared with the middle-aged participants, they were more likely to identify hearing loss, cognitive inactive, social isolation, alcohol, dyslipidemia, smoking, and unhealthy diet as dementia risk factors. And people who have a higher annual income level, they were more likely to identify hearing loss, physical inactive, and smoking as risk factors for dementia. And for people who have a higher education level, they were more likely to identify hearing loss, hypertension, obesity, smoking, and unhealthy diet as dementia risk factors. And people who have no memory complaint, they were less likely to identify several dementia risk factors, including hearing loss and smoking. And for people who have no contact with anyone with dementia, they were less likely to identify the depression, hypertension, diabetes, obesity, and unhealthy diet as risk factors for dementia. So these findings really highlight the need to develop different education strategies for people from different social demographic backgrounds. And regarding the results on the health education needs of dementia, most of the respondents thought that they were not well informed about dementia from public education by the government or media or medical institutions. And when we asked about their preferred health education format, most of the respondents would like to receive advice from family physicians and community nurses, followed by education booklets and community bulletin and talks by experts and regular peer sharing. Though this preliminary study has its limitations in small sample size and non-representative sample, the results did reveal a great gap between the Chinese Journal Public Knowledge of Dementia Prevention with the latest research evidence, which highlight urgent need to promote dementia prevention knowledge among the Chinese general public across all age groups, because we can see that these modifiable risk factors actually occur throughout the lifespan. And the great gaps between the research evidence and the practice imply that implementation science using community engaging approach should be advocated in this area. The partnership between the researchers and practitioners can help translate evidence into community practice in a more timely manner. And since cardiovascular factors are least endorsed by the public as dementia risk factors, we should design health education programs that emphasize the link between cardiovascular risk factors and dementia. And we suggest that health advice could be delivered by primary care providers during routine chronic disease management. And so as we identify that participants prefer receiving dementia-related health advice from family physicians and community nurses. And special attention should be paid to the population with low income and low education, because they are associated with a low level of dementia prevention knowledge. And at last, I want to say that improving public understanding of dementia is actually a very challenging task, requires global effort. But in the meantime, everyone in the society can do their part to raise the awareness of dementia prevention, such as self-education and information sharing, just like today's seminar. And thanks to the organization of this webinar, which provide a great platform to share the research evidence. And I'm very looking forward to the future collaborations on this platform to strengthen our efforts on dementia prevention. Thank you. These are the reference, and welcome any comments and questions. Thank you.